Welcome, Gold Delegates. I'm Fleur Bickford, Program Director and MC for Gold Perinatal 2015. I'm here today chatting with Sandra Edson, who is going to be presenting for us about hypertensive disorders in pregnancy and the postpartum period. So thank you, Sandra, for being with us today.
You're welcome. I'm happy to be here.
Wonderful. So to get started, I'm hoping you can just tell us a little bit about your professional journey as a nurse and how you became interested in perinatal care.
That's a great question. I entered nursing school actually with the desire to go into prenatal care and possibly become a midwife. And I had a great mentor through nursing school who really said, you know what, get into nursing, get into obstetric care, and then get some really good years of experience and then decide where you want to go with it from there. So I took her advice. And after getting into obstetric nursing, I was a labor and delivery nurse for many years. I decided instead of going to midwifery school that I actually wanted to go into teaching, not just to teach nursing students, but also to really advance the education of the nurses on the unit, which is why I'm in the current job that I am, which is nurse educator of the labor and delivery unit at my hospital.
That's wonderful. So you're going to be talking to us about hypertensive disorders, which I think is such a great topic. I'd love to hear a little bit from you about what do you feel are some of the biggest misconceptions when it comes to hypertensive disorders in pregnancy?
I think it's really important to look at hypertensive disorders in pregnancy as a dynamic process that's really occurring with the women that we take care of. I think oftentimes we see a little bit of hypertension and then we don't expect that it's going to progress into anything further. When in fact, I think all hypertension in pregnancy really needs to be looked at critically because we know that it can affect every organ in the body. And we really need to ensure that we are assessing these patients effectively and communicating with the providers effectively when we see any changes that occur with the patients.
Okay, thank you. So do you find, like, on your own unit, is this something that people are really looking for more information on? I'm just curious about sort of how you came up with, like, why you decided to focus on hypertensive disorders. I know you're going to be talking about some of the guidelines and stuff. Just why is this such an interest for you?
I find it an interest because looking at our unit, we are a tertiary care center, and we do take care of a lot of women with hypertensive disorders across the spectrum from just gestational hypertension to severe features of preeclampsia. And the staff comes to me often to say, I just feel like we just see more and more hypertension coming into our unit, and we just want to know more information about it so that we can effectively take care of the patients. And what are we supposed to be doing? Are we missing anything? So there's definitely a lot of questions from the nursing staff so that they can make sure they have the best understanding possible. So that really has driven me to say, okay, let's take a look at preeclampsia at our institution. What are our screening protocols, and how can we improve on what we're doing here for the benefit of our patients?
That sounds fantastic. Interesting that, the nurses on your unit are feeling like they're seeing more of it. So I'm really looking forward to hearing your presentation and learning some more about all of this. What do you hope delegates, the healthcare professionals who are watching the presentation, what do you hope they're going to take away from this presentation?
I really hope that the delegates not only understand the hypertensive disorder spectrum that we are faced with, but also the fact that it's an interdisciplinary approach that we need to take to tackle this, and that we really need to look at our systems in our hospitals to ensure that we're not missing anything, and that we have good systems in place for all of the members of the interdisciplinary team to play the role that is necessary to treat these patients effectively and hopefully prevent any adverse outcomes.
Okay, sounds wonderful. I love the term spectrum because it's so true that it really is a spectrum, and I look forward to hearing more about that in your presentation. So thank you so much for taking the time to chat with me today. And for our delegates who are listening, you will be able to join Sandra live to hear more about hypertensive disorders in pregnancy and the postpartum period on Monday, October 26th at 1500 UTC. And her recording will be available throughout the duration of the conference, but we do hope that you will be able to join us live. So we look forward to seeing you during the conference, and have a wonderful rest of your day.